You're watching TV9 News and I'm Prajwal D'Souza. For the second consecutive day, India has recorded over 3 lakh COVID-19 cases and over 2,000 deaths. The situation is becoming grim as the days pass by in the country. Now, keeping in mind the rapid increase in cases, the All India Institute of Medical Sciences has released new guidelines for treating COVID-19 cases among adults in the country. These guidelines are important in case you or anyone from your family is isolating at home. Now, these guidelines include 3 main parts depending on the severity of the cases. They are mild, moderate and severe. Let us first look at mild cases. How do you identify a mild case? The guidelines say that a patient has a mild case when he experiences upper respiratory tract symptoms coupled with or without fever and no shortness of breath or bouts of hypoxia, which generally means an absence of enough oxygen in the body. Now, what is next? It is recommended that patients who have a mild case should be isolated and cared for at their house. Now that you have isolated yourself, you should focus on these important points. Practice social distancing, wear a mask and wash your hands frequently. Now, these symptoms can be managed at home through hydration and by taking multivitamins according to the guidelines. Now, when you are isolating at home, you should always keep in touch with your physician or the doctor who is treating you and monitor your temperature and oxygen saturation levels. Now, oxygen saturation levels can be observed through a pulse oximeter. To understand the usage of a pulse oximeter, you can watch my previous video. The link will be in the description. Now, when should you go to a doctor? Now, you should seek medical advice if you have difficulty breathing or see a high-grade fever or a severe cough. A low threshold should also be maintained for people above the age of 60 who might have comorbidities. AIIMS has also highlighted some of the drugs that can be taken, but these therapies are based on low certainty of evidence. However, we do not recommend taking these drugs and you should first consult your doctor. Now, the 3 drugs that are recommended by AIIMS are ivermectin, hydroxychloroquine and budesonide. The dosage of the drugs as recommended by AIIMS is on my left. Ivermectin should be avoided in pregnant and lactating women. Hydroxychloroquine should be used if there is no contraindication. Now, during contraindication, a patient should not be given a drug if it proves to be harmful to him. Now, the third drug, budesonide, should be given if symptoms continue beyond 5 days since the infection. I want to emphasize again that you should not self-administer these drugs unless they are recommended to you by a doctor. The Institute also issued guidelines for managing patients with mild and severe conditions, which are mainly for doctors. The detailed guidelines are available on the Health Ministry's website. I will provide a link in the description. In the meantime, do not let your guard down and maintain all the safety protocols, including wearing a mask, maintaining social distancing and washing hands. If you like this content, do give this video a big thumbs up and don't forget to subscribe to TV9 News on all the social media platforms. Thank you for watching and stay safe.